Unsafe abortion occurs when a pregnancy is terminated either by a person lacking the necessary skills or information or an environment that does not conform to minimal medical standards, or both. However, it is no news that in Ghana, many women and young girls still engage in unsafe abortion. Speaking to the country director of Appiah Ghana, Dr. Appiah laments the rates of unsafe abortion, 32% in rural Ghana, saying after many years of campaign and education, it is disheartening that the country still records such an overwhelming number.
I'm even surprised that at this stage, with all the campaign that has started some time ago, girls and women are still involved in unsafe abortion practices. We started our work in 2006 talking about this same issue because it was recorded in two major hospitals, that's Kolebu Teaching Hospital and Konfanochi Teaching Hospitals, that respectively we have 30% of all deaths of women attributable to unsafe abortion in Kolebu and 22 in Konfanochi Teaching Hospital. We thought that was a reason for us to intervene to try to help women, save women's lives due to unsafe abortion. So if by 2018 we are still talking about 32% of unsafe abortion, it's a worrying situation because there'll be a lot of campaigns against unsafe abortion in the country. Luckily for Ghana, since 1985, there's been a law on abortion in Ghana, which has been implemented since 2006. That women now have access to both private and public hospitals to have safe services. So why women and girls will still go for unsafe abortion is quite worrying. So 32% is quite high for Ghana because Ghana is leading in most of African countries apart from Ethiopia that the law allows a woman to have these services easily in hospitals, both private and public, as I've stated. So if women are still going for such unsafe practices in Ghana, then we need to be worried because we have had a lot of campaigns against that. Most TV stations, including yours, have spoken about that. And newspapers have written about that. So I don't see why at this stage women are pushed to this level where the only way to resort to abortion is to go for the unsafe method.
His comment came at the back of a research report that stated that 32% of the country's rural women still engage in unsafe abortion. He, however, stated that to prevent unintended pregnancies and unsafe abortions, countries must make supportive policies and financial commitment to provide comprehensive sexuality education, a wide range of contraceptive methods, including emergency contraception, accurate family planning, counseling, and access to safe legal abortion, adding he is glad the Ministry of Health has embraced the idea and will start working on adding age-appropriate sexuality education onto the school curricula.
Well, there's argument back and forth. It's important that we take it much broader than the discussion. We call it age-appropriate sexuality education in schools. Age-appropriate. We like it or not, sex is happening in schools. I've been to schools where class 6 girls have 2 kids or they have several abortions. JSS1, SSF, all these are happening. So when the MP was talking about if it is happening, what can we do to prevent it? If it's happening, what can we do to make sure that we can, these girls can go through school, and finish?
Provision of safe legal abortion is essential to fulfilling the global commitment of the Sustainable Development Goal of universal access to sexual and reproductive health. WHO provides global technical and policy guidance on the use of contraception to prevent unintended pregnancy and unsafe abortion and the treatment of complications from unsafe abortions.